All right. Hello, internet people. This is Keaton Andreas. I am the Assistant Director of Outreach for Child Family Health International. I have joining me today one of our alums from A.T. Still University of Osteopathic Medicine. Megan, could you introduce yourself?
Hi, my name is Meghan Brombach. I'm a fourth year now osteopathic medical student, and I'm excited to be here. I just spent a month in La Paz, Bolivia, with Child Family Health International, and I'm excited to talk with you today.
Well, thank you so much for your time. And I know that we had a conversation leading up to this point. So we've been talking already, and we had what was a really fascinating conversation. Parts of it I really wanted to bring forward for this video setting is the fact that at CFHI, we're having a conversation with the entire context of within global health, what would be referred to as education abroad, particularly the practice of sending short-term student trainees into international contexts. And from your experience of the last month, what are some of your reflections on the process of how CFHI goes about that, or how we differ from other organizations out there?
So yeah, I guess if I could just start with kind of my experience in the past, I've just so that everyone knows where I'm coming from. I have had a few experiences going abroad with different organizations. I've been to different areas, and this was my first opportunity to kind of go to South America with an organization that was very established. And I will say that my experience with Child Family Health International was really set apart in that it gave us the opportunity to kind of come into an environment that was already set up with doctors and individuals that were established and really deeply embedded into the community. And it helped us to feel like we were learning this incredible sort of culturally very relevant perspective of medicine from their perspective, and we were able to work with them. And then we were able to leave and not feel like we were sort of just leaving something that wasn't sustainable. And that experience was unique from the past experiences that I've had in Kenya and in India as well. And so that was a really great experience.
What would you say it felt like in your other experiences, leaving behind something that you weren't sure was sustainable, or that you weren't sure was going to be managed properly after you return?
So did you say give you an example?
Yeah, I was just saying, like, what did it feel like in those circumstances?
Absolutely. I think I can say the first experience that I had was when I went to Kenya, and it was with an organization that wasn't very well established, and it only had a few students go before me in kind of a kind of official capacity. And so when I went, I was sort of creating kind of my own sort of map for what the month would look like. And I did some teaching, and I got to volunteer in the clinic. But what was so hard about that was that I was kind of creating these relationships with people, and then because the communication and the internet there is so poor, I wasn't really able to continue on. And there were no leaders on the ground that I was able to talk with and then would be there. And so everything that I created in terms of I created some clubs for some students at the school. So we had some music, and we had some soccer and some art clubs. And all of those, I have no idea what happened to them. They could just have dissipated. because it wasn't an established kind of thing that was going on, and there weren't local people that were there already sort of continuing on those things that we had already created, or that we had created together. And it was also hard too, because I think, so the thing that was so great about CFHI is that when we got there, there were many physicians that had been there for a long time, and they have relationships with patients already like preset. And then you get to come in and you get to understand what their relationship is with that patient. And you get to observe it, and you get to learn from how they treat a patient from their own, I guess, perspective and in their own language. And then you get to step back and kind of reflect on what you've learned, versus you going in and kind of fumbling through in your native language, but that's not their native language, and you're really unsure of your communication skills. And so also in Kenya, people speak English. English is the national language, but so is Kiswahili. And Kiswahili is really the language that most people speak. And so because I wasn't fluent in that, a lot of times translating medication, how to take medication, what to do sort of when you're done with the medication, or what to do with your wound after the dressing gets dirty, those sort of really important things sometimes were lost in translation, and you don't really know. And so you leave that experience feeling like you feel like your life was really like opened, and that you were really touched by the experience, but you're not really sure if what you did was good or was harmful. And that's the difference between going with an organization that doesn't have these really like set in place wonderful individuals that already have these relationships, that are practicing safe medicine, versus going and just being on your own and kind of being a rogue sort of student that doesn't necessarily have the skills. And CFHI also talks about, you don't practice medicine beyond your level of education. And I think that that's very important across the world. I mean, that's an ethical perspective that we have to have across the world, regardless of if we're in another country that might allow you to do more, but that's still not ethically okay for patients. And I really, really respect that about Child Family Health International.
Yeah, I think one of our main values and what we lead discussions and students with, and we even lead academic research in this, is people being aware of their privilege and in their position of power when they're traveling as a short-term trainee.
Very true.
Just to kind of, as a final thought, were there any moments or any singular moments that stood out to you during your month there where you felt aware of your own privilege, or have you reflected on that in any way since your return?
Absolutely. I can say that even just stepping into the hospital there, the Hospital del Niño, the children's hospital, that's where we spent the majority of our time. Just stepping into that hospital with a white coat, individuals, residents and attendings alike, as well as patients, automatically just think that you're at the exact same level as they are. And patients all day long would approach me or would approach my classmate. They'd tap on our shoulder and they'd ask us a medical question that they truly believed we had the answer to, and that everything we said would be sort of, exactly the truth. And that was a very like humbling experience, because it made me realize that, we always had to defer and sort of ask the attending physician that we were with and just say, hey, this patient needs this. And it was just like a really overwhelming sense of kind of responsibility, because they're putting all of their faith into your hands, and you're just realizing that, true, I think as well, coming from the US and looking the way that we did, we look different. And so individuals, a lot of patients too, are going to be clued into that just automatically. That's something that they're going to be much more aware of. And so they're going to be looking at us and asking us questions. And we experienced that a lot. You know, we stood out, and so we had more attention. And with that too comes even more sort of sensitivity and responsibility to not take advantage of that attention.
Yeah, no, I think that observation is really going to help, like anybody that's either looking to go on one of our programs or just thinking about this topic in general. And I want to thank you again for your time today. Sadly, we're out of time for this conversation. I'm sure we'll talk more in the future. For those of you who may be watching this, you can find out more about the program that Meghan went on. It is our program in La Paz, Bolivia, our pediatric program. And it runs year-round for 4 weeks at a time. You can go longer than that, but just check out cfhi.org /all programs. You can see almost all of our nearly 40 programs located across 10 different countries right there. Again, this has been Keaton Andreas broadcasting live with Meghan Brombach, who's joining us today from the Los Angeles area. And until next time, I'll be bringing you more alumni videos and other bits of information from CFHI. I hope you enjoyed.